What does science tell us about addiction?
Well, so let's just step back and just talk about what addiction is, how we define it in medicine. In medicine, we define addiction as disruptions in the person's psychosocial functioning as a result of the drug use. So that is like people are failing to meet their obligations, like at work or at school or within the family. And that's one component. And then the second component is that these folks who are failing to meet these obligations are distressed by these disruptions. So you got to have not only the disruptions, but you also have to have the stress felt by the person. So that's the definition in medicine. We do have some physiological effects that can go along with addiction, but the physiological effects in of themselves are not addiction. What I'm talking about is things like tolerance. That is, when a person takes a drug repeatedly over an extended period of time, they require more of the drug to have the effect that they once experienced from less of the drug. So that's tolerant. And another physiological effect is withdrawal symptoms that might occur after someone who had been taking a drug chronically abruptly discontinues their use. Then they might see unpleasant effects like vomiting, diarrhea, headaches. They can go along with addiction, but they in of themselves are not the definition of addiction.
How about substance abuse and taking drugs and the percentage of us who would be impacted by that?
So it varies depending on the drug. And then when we think about predictors, what will predict whether someone will become addicted? We like to look at genetics because genetics seems to be an easy sort of way to identify people. Unfortunately, we have no really good genetic predictors for addiction. You know, the rates of children of alcoholics who become addicted, the rates can range anywhere from 5% to 50%. And so even those numbers are not the most reliable, but we do have some psychosocial factors that are pretty good predictors of who will become addicted. For example, when you look at the pool of addicted people, a large percentage of those individuals have co-occurring psychiatric illnesses. That is, a large percentage of them have depression. A large percentage of them might be schizophrenic. A large percentage of them may have an anxiety disorder. So co-occurring disorders, whether it's psychiatric disorders or pain disorders, predict whether or not someone might become addicted. Other factors include, like, when you have people subjected to unrealistic expectations continuously, that also increases the likelihood of someone might becoming addicted. When we have people who were once gainfully employed and they were someone in their community and now they are no one, and that also increases the likelihood that someone might have some problems with drugs. So you see all of these different factors can impact upon the likelihood of someone becoming addicted.
Is there a dose dependency across the board? Could you look at alcohol and cocaine and heroin or marijuana and say, you know what? You know, a little bit of some stuff is not harmful, a little bit more might be helpful, a little bit more might then lead to dependency that can have what we call addictive behavior. So, can a lot of this be just reduced to dosage? And if we can figure that out right, there might be some benefits to the whole pathway of these different substances?
Dose is one of the most critical component in determining drug effects. At one dose, a drug is a therapeutic. It's helpful, it's beneficial. At another dose, that drug can be toxic. That is, it kills brain cells or it may kill you. So dose is everything. When we think about something like morphine or any other opioid, these drugs have been used for centuries in terms of decreasing people's pain. But yet we know that at some doses, people can, for example, overdose on opioids and have respiratory depression and ultimately die. Same is true with something like alcohol. At one dose, alcohol is really good at producing anxiety relieving effects. And then at another dose, alcohol can produce respiratory depression and kill a person. So dose is everything when we talk about drugs.
Dr. Hart, thank you so much for joining us on QED with Dr. B.